Hey everyone, thanks for being here today. Just a reminder that we'll have some quick comments from our speakers and feedback too. And then afterwards, until 10:45, everyone in this facility is consented. So you're welcome to do interviews to your heart's content, talk to people at any stage of the process. But we do need to clear the place at 10:45. So we appreciate your cooperation with that. And with that, I'm just going to turn the mic over to Kim Shepard, the Arizona Market President for Cigna, which has been a terrific partner.
Thank you so much. At Cigna, our mission is to improve the health, well-being, and peace of mind of those we serve, and to support the communities in which we live and work. So from our perspective, what better way to give back to our community than helping them get back to getting together. So as you've seen here, we're all about creating a community of immunity. We are so thankful for the opportunity that the state and DEMA have given us to do this in our partnership with the City of Scottsdale. We couldn't have done this by ourselves, so we are thrilled to be here. Tell all your friends, come out, get your vaccination, and we will all get back to getting together. Any questions I can answer from the Cigna side? We have roughly, our shifts are scheduled at about, we run 2 shifts a day. We're scheduled at about 70 volunteers in each shift on the non-clinical side. And then on the clinical side, we have about 25 volunteers. So Cigna, because we own Cigna Medical Group and Express Scripts, we can actually cover the pharmacy and the clinical components of this, as well as the operations. So along with the City of Scottsdale, this is pretty much an internal operation for us. So our goal time-wise, not including observation, is to get people through the shot lines in about 10 to 12 minutes, and then your 15 minutes of observation. Our goal is to be under 30 in total.
I see you guys have the clock done. That's to keep you guys on schedule?
Actually, no, that's actually for once you get your vaccine, whoever gives you your vaccine will tell you the time of your vaccine, and that's how you start tracking your observation time. So the nurses look this way for the race clock, and people sitting in observation, or there's another clock over there so that they know if they got their shot at 10:15 and they're a 15-minute person, they can leave at 10:30. Sure, the hours of this location are currently scheduled for 7 a.m. to 5 p.m., 7 days a week. And we are, if we hit full capacity, and those at that time frame, we have capacity to run through 500 people an hour. So 5,000 shots a day for that 10-hour span. So it really depends on, we need more bodies in here, as you can see. So we know we're new, and we're hoping you guys will help us get the word out that we're here and we're ready to put shots in arms.
Are you guys accepting walk-ins also?
Absolutely. In fact, ADOT just changed the sign on the highway today saying walk-ins accepted. So we do have capacity for walk-ins. Anything else? All right, then I'm going to turn it over to Mayor Ortega from the City of Scottsdale.
Welcome to WestWorld, Scottsdale, Arizona. This is the new location for better health in all of Arizona. I say this because we are in partnership and we are providing every resource the City of Scottsdale has for all people. You will notice there are signs on the freeway directing you here, as well as all of the volunteers assisting as well. I welcome you to Scottsdale, Arizona. We are on a pathway for better health, and residency is not required. Si quieres llegar, le pueden ayudar sin problema. Llega aquí y se pueden ayudar para mejor salud para todo el pueblo. We welcome and thank especially Dr. Christ. She has the endurance and the stamina and the knowledge. Taking her advice is the best opinion we can have for better health. So I credit her, and I will say at all times, we stand ready and appreciate Cigna so much as our health partner here in Scottsdale. So let's get it done. And we have plenty of room. You can make all of your appointments or walk in. Thank you so much, Dr. Christ.
Thank you so much, Mayor. Today is an exciting day. So this is the first state-operated pod in this part of the valley. This will serve the North Valley area. As you can see, it is fully indoors. We have lots of capacity for vaccine. Today, we have reached our 2 millionth Arizonan who is fully vaccinated. So that's a very, very exciting milestone, but we still have more work to do. One of the things that we would say is, we know that we've been vaccinating for a while. Before, there was lots of demand and not many appointments. Now we have lots of appointments to meet that demand. In many cases, you can either walk up to like this site now to get vaccine whenever you are ready, or you can find a same-day appointment at almost all of our state-operated pods. The vaccines are safe, they're effective, they're available, and they're free. So we would recommend that all Arizonans go get vaccinated as quickly as possible. So we want to thank Cigna and the City of Scottsdale, and of course our partners at DEMA for this fantastic venue. We're very, very excited about opening today, and it just adds one more site where Arizonans can go get vaccinated. So thank you, and I'm happy to take any questions.
Talk about why you chose this site.
So initially, remember when we were working with Maricopa County and they had identified various pods around the valley? What we wanted to do was to create a site that maintained that location. So we were very, very excited about this site, and when we partnered with the City of Scottsdale and Cigna, this was to replace the North Valley one that Honor Health did such a great job at vaccinating.
Do you expect this to be a busy site? If you start to see people not coming in, what is the next step beyond the PSA? How do we get people to buy in to coming and getting their shot so that we can all be together?
Right, so what we want to make sure that we're doing is encouraging all Arizonans to get vaccinated. We will increase our messaging. We will be doing reach out. They've got a really great program here where it's sponsor of the day. So they'll partner with a community business or partner to bring in volunteers or to vaccinate their employees. I think that that's a really great way to bring people in. But you may start seeing us shift some of those our messaging. So, really trying to incentivize people to come in and get vaccinated and make it more convenient. So in addition to opening up these sites, you'll see that we're working with community partners to get it into the community to also increase the convenience. But just like they said, we're looking at walk-ins now. We're looking at different ways to make it more convenient for Arizonans when they are ready to get vaccinated.
How can we incentivize people? So the Biden administration talked about giving tax credits to incentivize people to get vaccinated. What can Arizona do? Can we give them free Barrett Jackson tickets? I don't know. What can we do to give incentive that doesn't overdo it but doesn't underdo it too?
Right, so there's a lot of different programs that different vaccination groups put together. My kids like going to Target to get their flu shot because you get the $5 or $10 off of the purchases and things. So there's a lot of creative ideas. I like your idea, Cameron. So we'll work with partners to identify what types of tools we have to be able to incentivize Arizonans.
Is the goal to move all of the vaccine sites outside indoors as our temperature rise?
Yeah, so that's a great question. So as tomorrow, when we close down State Farm and transition it to Gila River Arena, all of our state-operated pods will be indoors.
And do you think it'll be harder to get volunteers in the summer? People can now travel, they might have plans. It'll be hot, maybe they don't want to volunteer.
So that was one of the reasons we definitely wanted to move indoors, because we were concerned with the safety of our staff, our patients, our volunteers. So I think that this will help us maintain volunteers, that they're not standing outside in a parking lot where it can get really hot. We're hoping that we'll be able to continue to engage volunteers. They've been such an important part of this process. It really, really is a great experience. So if any of you guys wanted to do like a sponsor of the day, let us know and we'll work with you guys to come down. But anybody who wants to volunteer, we've got a mechanism to get them in.
Do you need more volunteers right now? But it seems things kind of taper off. And how can people sign
So you can go to our website. I can get Steve to give the website. It depends on which site you're volunteering at. They've got different volunteer registrations, but we can help you with that. Right now, we do have a pretty good supply of volunteers, but we can always use more. So we'll take whoever wants to help us. Oh yes.
I think we should look at the biggest reward or incentive is getting back to your library, getting back to work, enjoying the outdoors, being able to hug your family and neighbors. So that is the greatest reward. It's not a cash reward, it's a back to life reward. It's enjoying Scottsdale again, it's enjoying any part of the city, and those incentives are what we look forward to overall in the wellness and our quality of life here in Scottsdale and everywhere else.
Yeah, and this is, like we've said, this is really our way back to normalcy. So returning to those things that we love. I love the slogan that Cigna came up with, to be a community of immunity, because it really does take the whole community to protect those that are most at risk for bad outcomes from COVID-19. So that is something that we are looking at. So you will see it at more doctors' offices and community health centers. We are just maintaining geographical availability of these state pods. They are still efficient. We're still doing, 10 to 20,000 vaccinations a day at the state pods. So I think that they're still an important tool. We continue to reassess, but one of the shifts that you'll see eventually is it will move from the state being the allocator of the vaccine to the normal vaccine ordering process. And that's when you'll start to see it get into more and more doctors' offices and community health centers, just like you see your flu vaccine, your measles vaccine, those types of things.
When do you think that'll be?
We are hoping soon.
And a lot of polling suggests that one of the most vaccine hesitant groups is Republican men. So you've had a lot of events like this, but Doug Ducey hasn't been to many of them. So is he planning on getting out more to promote vaccines among his supporters?
So unfortunately, these get coordinated very, very quickly, and so it's hard to coordinate with his schedule, but he's actually come out to the sites multiple times. He really enjoys being on site and interacting with the volunteers and the patients. It's actually a really rewarding experience to be out here. Steve actually had to pull me out of the vaccination tent because it really is it's such a good experience. So I know he's really supportive of these. It's just, he's got so much going on that sometimes coordinating this with his schedule is a little bit difficult.
What's going on with the Johnson & Johnson? Are you hearing anything about what's going on with that? When and if it does get unpaused, which we expect it to, how will you implement that to the community? And will you have messaging to reassure and inform people on possible new recommendations for using the Johnson & Johnson? How will you handle it?
So that's a great question. This is about the Johnson & Johnson and if we're hearing anything about that. So the Advisory Committee on Immunization Practices is supposed to be meeting either today or tomorrow. They wanted an additional week to review additional data so that they could make a recommendation. We are hoping that eventually the Johnson & Johnson becomes unpaused. We haven't really heard a lot more information since last week, but we will have messaging. Again, this was 6 events. It shows you how sensitive our safety, like our adverse safety monitoring system is, or the VAERS. It picks up a signal, they look into it. This was 6 cases out of almost 7 million vaccines. That's, it's more than a 1 in a million chance. However, they want to make sure that they're doing their due diligence, that they're working with an abundance of caution. So we will be, when we get the information, we will be, making sure that people know how safe and effective that is based on the information that we get from FDA and CDC.
Yeah, because I assume you're going to face some pushback from the community in the immediate aftermath of unpausing a vaccine that got so much attention. variants. Clearly, we've seen one arise in Texas recently. Antibody resistant, very transmissive, can cause severe impact health-wise. Are you concerned about that variant? And are you pushing people to understand that if they don't get vaccinated, we are creating variants?
So that's exactly right. So viruses mutate. That's just what they do. And so we are always concerned about about a new variant that could come on. Right now, all the variants that we are watching, the vaccine is effective against. But it is important to get everyone vaccinated, because the more viruses spread and reproduce, the more chance they have on mutating. The less chances we give that virus to infect somebody else, the less chance it has to mutate into something that could be resistant to the vaccine or to the medications that we have. So we really want to make sure that everyone is vaccinated and following those normal precautions.
With walk-ins, are there vaccine freezers on site here?
Yeah, so there's actually a pharmacy across the street that they're drawing up, just like we do. So we have a pharmacy on site at all of the state-operated pods. They're drawing it up based on the demand. That's something that they watch very closely. But yeah, there's one of the freezers in the pharmacy.
How many people do this every day?
So they can do 5,000 a day, so approximately 500 per hour. We're going to start a little bit slower just as we get up and going, but that's the overall capacity. All right. Well, thank you guys. Oh,
Otra vez, todo el mundo puede llegar aquí para tomar vacaciones. No, papeles no son necesarios. Es para mejor salud de todo el mundo. Gracias.
Thanks again. A quick reminder, we'll have a similar event tomorrow at 11 at Gila River Arena. Also, till 10:45, this is all access, but we do need to close the facility to press at 10:45 so we can open this as a secure medical facility. So go nuts. Dr. Christ will be vaccinating one of the lanes. If you're sick of Dr. Christ, you can go to another lane to get people being vaccinated. So have fun.